Hi, this is Dr. Chan here at Dentistry. You get a lot of questions about tooth decay, so today we're going to answer some of the most common questions about tooth decay, and hopefully you can get a better understanding of what tooth decay is all about. So, when you hear the words tooth decay, that's basically another word for cavities. Essentially, you have an infection that's growing in your teeth, and usually that's caused by bacteria in the mouth. Everybody has bacteria in their mouth. Some of it's good, some of it's bad. Some of the bad ones are bacteria that cause cavities or tooth decay. So dental decay is caused by bacteria that's in your mouth. Everybody has bacteria in their mouths. Some of it's good, some of it's bad. Some of the bad bacteria are ones, for example, that cause gum disease. Another one causes tooth decay or cavities. Basically, when there's too much of this bacteria in contact or in the surrounding areas of your teeth, and it's not either brushed, flossed, or rinsed off, it starts to eat away at your teeth, basically forming an infection in your teeth, which eventually causes a breakdown of the tooth, and sometimes, if taken far enough, loss of your tooth. On the surface, when tooth decay is small, a lot of times you can't see it or detect it. One of the biggest reasons that we take x-rays is that we can see tooth decay forming at an earlier stage than we can see just with our naked eyes. A lot of times, tooth decay will start in places that we can't see very well, such as the spaces right in between the teeth. X-rays are really good for seeing into the middle of our teeth so that we can see if tooth decay is forming or not. Sometimes when tooth decay progresses, we're able to see it because our teeth will either change color or parts of the tooth will either change shape or break off. A lot of times, if it gets really bad, you'll actually start to see holes in your tooth. One of the biggest effects, negative of course, on your teeth of tooth decay is that it essentially starts to eat away or break down your teeth. So you'll see holes forming in your teeth, or sometimes you'll see parts of the tooth become soft or rough. Healthy teeth are strong, solid, and smooth, well, at least on the sides. When there's tooth decay present, a lot of times they'll feel rough or bumpy, or, like I said, if taken to the extreme, parts of the tooth will actually start to fall away or crumble or break off. So tooth decay can definitely lead to other complications if it's not treated or taken care of. One of the biggest things that it can lead to, at least when taken to the extreme, is that you could lose your tooth. On a earlier stage, if we are able to catch it earlier, usually a part of the tooth will be damaged or infected. If we're able to catch it, sometimes we can just remove the part that's infected and hopefully save the majority of your tooth so that you don't have to lose it. Unfortunately, once a tooth decay starts, we can't reverse it. The only way that it can be removed from your tooth is that it either has to be scooped or drilled out. Usually in those cases, obviously part of the tooth will now be missing, and in order to fix the problem, we have to either put in sealing, or if the tooth decay was present on multiple surfaces on the tooth, a lot of times a crown, or even a root canal may be indicated. The treatment for tooth decay depends on when we catch the tooth decay in your tooth, at what stage, and how much tooth decay is present on the tooth. If not that much decay is present, then a lot of times we can remove the infected part of your tooth and then put a filling in. If a lot of tooth decay is present on the tooth, or multiple surfaces of your tooth have been infected with tooth decay, then a crown may be indicated in order to protect the tooth and keep it strong and stable. If the tooth decay was present for a long time and it went really deep into your tooth, it's possible that a root canal may be needed in order to clean out your nerve in the middle of your tooth. And of course, unfortunately, if tooth decay takes over a majority of your tooth, a lot of times the tooth can't be saved and it needs to be taken out. Fortunately, there are options to replace your tooth. One of the biggest ones is implants. Another option for replacing your tooth are bridges. One of the best ways to prevent tooth decay from spreading or even starting in the first place is to be really good about maintaining your oral hygiene at home. What that means is brushing on a regular basis, flossing on a regular basis, making sure you rinse your mouth out after you eat or drink anything really, but especially sugary foods. One of the biggest problems with sweet foods is that obviously they contain sugar. The bacteria in your mouth love to eat this sugar. And so when there's more sugar present in your mouth, the bacteria will eat it and they'll grow in number and in size. And so basically, the more bacteria there are, the more they can infect your teeth and lead to tooth decay. If you suspect that you have tooth decay, you should definitely see your dentist as soon as possible. There are a couple of signs that you might notice. One of the first signs that people with tooth decay will notice is that their teeth will feel sensitive, either to biting, too hot, or too cold. Now, just because you have sensitivity in your teeth doesn't necessarily mean that there's tooth decay present, but one of the first signs of people that have tooth decay is definitely biting or temperature sensitivity. Another thing that people will notice is also they might have pain, either spontaneously or, like I said, when they bite or eat or drink. If any of those cases apply to you, please call our office as soon as possible. Our number is 916-285-9678, or you can visit us on our website, www.crowndentistry.net, and we can help you. Thank you.